Good morning, everyone. Thank you all for being here. It's great to be here at Valle del Sol as we come together to talk about historic cost reductions to make healthcare more affordable for seniors in our state and across the country. I'm honored to be joined by Valle del Sol's very own Paulette Rangel. Did I say that right? All right. And Dr. John Molina, who I've now been seeing at least for 3 weeks in a row. I'm sorry I keep bothering you, Doctor. We're also here with my good friend Dora Vasquez, Executive Director of the Arizona Alliance for Retired Americans, and Mary Lynn Kasink, and CEO of the Area Agency on Aging, both great forces for good in this area. And of course, our old friend Teresa Dickinson, from owner of the Melrose Pharmacy, an independent pharmacy, long serving our community in the Melrose area, and Manny Hernandez, a local resident who knows firsthand how expensive it is to access life-saving medication like insulin. And of course, a lot of old friends here. Thank you all for being here. I greatly appreciate it. Last August, President Biden signed into law the historic Inflation Reduction Act, which for the first time allows Medicare to negotiate lower prescription drugs prices for seniors. For decades, leaders have tried to take on Big Pharma and allow Medicare to negotiate lower prescription drug costs and failed. Despite obstructionist colleagues and opposing views, President Biden and Democrats got it done. Democrats in Congress also capped the cost of insulin for seniors on Medicare at just $35 a month. That is amazing considering how many seniors were rationing their insulin just to make it through a month. And I say Democrats because we fought tooth and nail to enact this common sense and humanitarian legislation. Thanks to the life-saving measure of the Inflation Reduction Act, Arizona seniors won't have to skip meals, go into debt, or fail to get the care that they need. Thanks to the Inflation Reduction Act, more than 28,000 Arizonans are going to save about $500 per year on their insulin. So now, when Arizona seniors head to Melrose Pharmacy, and make sure to pick up other stuff while you're there, they won't pay a penny more than $35 to get the insulin they need. While this is a cause for celebration, I'm also here to remind Arizonans that we are not done yet. True progress means continuing to fight to extend the insulin cap to all Americans, so no Arizonan, and I mean no one, deals with unnecessary barriers to get the care they needed. In fact, last time we were at your pharmacy, we were talking to a young lady who had to ration her insulin, and unfortunately she may still be subject to that. But we need to impose measures that caps the cost on all insulin for all patients, for every American, regardless of their insurance. And only, and this is the goal, and this is what we try to do, but it was only to have been struck down by obstructionist colleagues at the last minute. So shame on those colleagues for voting that, and shame on them for denying these savings to hardworking Americans. But despite this setback, we are going to continue to fight. We're continuing to advocate for every patient, for every beneficiary, so that no American is ever gouged by the price of insulin again. It should not matter whether you're on Medicare, have Medicare, or private insurance. It should not matter whether you're 6, 16, or 65. Insulin should be affordable for every Arizonan. Why? Very simply, because it is a life-saving medicine. And in many ways, insulin is the cost of living for families in Arizona. No Arizonan should be forced to choose between repairing their car, feeding their family, or getting the health care they need. Congress has a mandate to bring down the cost for our nation's most vulnerable residents, and I won't stop till we finish that job. And with that, I'd like to bring up to the podium Paulette Rangel, who will say a few words on behalf of Valle del Sol. Thank you. Go ahead, Paulette.
Thank you, Congressman. So since 1970, Valle del Sol has been committed to assisting in positive health outcomes for our Phoenix, Latino, and other diverse communities. For over 50 years, and throughout our 6 community health centers, our teams have coordinated their efforts to combine primary care and mental health services to allow an integrated health approach that is centered around treating the whole person, mind, body, and spirit. This approach allows us to address the social determinants of health that create barriers for our patients to receive care. Many of our patients that are diagnosed with diabetes are unable to afford the basic equipment, such as their meter that is needed to check their blood sugar every day, and are unable to afford their insulin and medications that are needed to control their disease and prevent complications that are caused by diabetes. In 2021, 11% of Arizonans reported being told by a healthcare professional that they have diabetes, and 21.4% of those are 65 years old or older. Our aging population already struggles enough with being able to afford afford housing or food on their limited income. And this very expensive equipment and life-saving medication is something that they have to decide if they're going to choose that over their basic needs. Because of the Inflation Reduction Act, they can now worry about one less thing and focus on their health moving forward. I want to thank Congressman Gallego, a graduate of our Hispanic Leadership Institute and a great friend of Valle del Sol, for his advocacy for the health of Arizona's community. Thank you for all you do, Congressman.
Thank you, Paulette. And thank you, Valle del Sol, for being so involved in our community here. And yes, I am a proud graduate of HLI, the HLI 2006, the best class ever. Don't make sure they know that. Okay, whatever. And now I'd like to introduce a good friend and a great community leader and advocate, Dr. John Molina.
Thank you, Congressman, and good morning and welcome everybody to this very, very important event. My name is John Molina. I'm a retired physician. I come from the community of Guadalupe. I also serve as the Health Services Director for Native Health, which is a federally qualified community health center as well as an urban Indian clinic here in Phoenix. We have 3 locations, one in Central Phoenix and Central and Indian School, Dunlap and 17th, and East Mesa Clinic on Extension and Southern Avenue. At Native Health, we do provide a wide variety of services, primary care services, as well as dental and behavioral health care, and an outstanding community health and wellness program that really does a lot of community-based programs. So we reach out to a lot of people. A lot of our people are underserved. They come from the Black, Hispanic, and Native American communities, our most underserved communities. And what we find that our underserved communities are the ones that are most impacted by this disease that we call diabetes. You know, since the discovery of insulin in 1921, over almost 102 years ago, this medication has saved a lot of lives, millions of lives over the last 100 years, and continues to do so. Diabetes continues to rise in our country, a lot of it due to hereditary factors, socioeconomic factors. Most impactors are people of color, people who live in poverty, lower education, and have a history of diabetes. A lot of us here, if I would say mostly all, if not all of us, have friends and family who've been impacted by diabetes. Diabetes brings on other diseases like heart attacks, eye problems, retinopathies, kidney disease. People go on dialysis. People lose their limbs if not for insulin. So what keeps people from getting insulin? Cost. And that's why we're here, and we really support these efforts to be able to bring down those costs for insulin so that people can live a better quality of life. People with diabetes live 5 years less than most people and suffer a lot of consequences. Takes them out of the loop to have a better quality of life and be more productive citizens in our community. So I'm really thankful to Congressman Gallegos and for the support of our individuals here to move forward to reduce the cost of insulin so that our people most impacted can have a better quality of life, can go on to become parents, great-grandparents, tatas and abuelitas, so that they can see their grandchildren. So thank you.
Yeah.
Appreciate it.
Thank you. And the Gallego family unfortunately has also had experience, not personally, but in our extended family with diabetes. So this is also extremely personal, as well as obviously our district unfortunately has a very high concentration population that is affected by diabetes. Next, I'd like to introduce a community leader and friend of Phoenix, Teresa Dickinson. Oh, I'm sorry. Dora, don't get mad at me. Dora's one of the few that can scold me, so I apologize. Our good friend, Dora, Senior and Executive Director of Arizona Alliance for Retired Americans. Sorry, Dora.
No problem. Good morning. Hello. I'm Dora Vasquez, Executive Director of the Alliance for Retired Americans. We represent the 48,000 members here in Arizona. It's my honor to be here today with Representative Ruben Gallego, Congressional District 3, Throughout his time in office, Rep. Gallego has been a champion for lowering drug prices and for protecting benefits that Arizona's seniors need and deserve after a lifetime of work. Representative Gallego has never failed us. He always votes on the sides of seniors, working families, and all of us here in Arizona. Thank you, Congressman. Lowering drug prices has been an Alliance priority for 19 years, and it took strong, consistent grassroots action by retirees to make the Inflation Reduction Act happen. Over and over, we met with our representatives and senators, held demonstrations and rallies, signed petitions, and we're thrilled that Congress is finally requiring Medicare to negotiate lower drug prices for some of the most expensive drugs. Our members are retired and have had a chance to see a few things. We know when a law truly changes people's lives, and President Biden's Inflation Reduction Act does that in several ways. We've had several members share their story of how lowering drug prices is a life changer. With the cost savings, they can now focus on other needs that will improve their health, peace of mind, and safety. Things like nutritious foods, updating their homes to protect from weather, and more. The Biden-Harris administration has made lowering prescription drug costs in America a key priority, and I'm already seeing the results of those efforts firsthand. The Inflation Reduction Act is giving millions of seniors more breathing room on health care costs every month. President Biden signed the Inflation Reduction Act into law because he believes people with Medicare shouldn't be on the hook when drug companies jack up the prices of their drugs. The drug industry spent a whopping $372 million lobbying to stop this legislation from passing, but it still passed because of all of everyone's hard work. Just last week, because of the Inflation Reduction Act, the Health and Human Services announced 27 prescription drugs for which Medicare Part B beneficiary coinsurances may be lower from April 1st to June 30th of this year. Some people with Medicare who take these drugs may save between $2 and $390 on average, depending on their individual coverage. By discouraging drug companies from increasing prices faster than inflation, this will lower out-of-pocket costs for some people with Medicare and save taxpayers money on pricey drugs. And that is on top of data that shows that 1.5 million seniors would have saved $500 per year on the cost of insulin in 2020 had the Inflation Reduction Act been in effect then. That's because of the $35 cap per month on insulin for Medicare beneficiaries. That is especially important when you consider that 600,000 adults here in Arizona have diabetes. President Biden knew what he was doing when he called for extending the $35 monthly cap on insulin to all Americans in his budget. Already, 2 of the 3 largest producers of insulin in the country, Eli Lilly and Novo Nordisk, announced they're answering his call and lowering insulin costs for all consumers. We welcome that change and hope it lasts. Amazingly, congressional Republicans, they say they want to repeal the Inflation Reduction Act. That would put money back in the pockets of big pharma and make it even harder for seniors and working families. We cannot go backwards. We must continue the progress we are making to make sure no American has to choose between putting food on the table and paying for the drugs they need to stay healthy. Thank you.
Thank you, Dora. And now I got this correctly. Our friend, owner of, something on today, Melrose Pharmacy, Teresa Dickinson.
Good morning. Thank you, Congressman Gallego, for inviting me here today. It's an honor and privilege to be invited by you and to have the opportunity to celebrate the Inflation Reduction Act and how it helps our seniors. We appreciate the Biden administration for its hard work on this important legislation and are grateful to Congress for the continued bipartisan support and efforts focused on combating the roots of the drug pricing issue, including and especially pharmacy benefit managers, or PBM, profiteering. It's absolutely amazing that you were able to make headway with the PBM lobby working against you. As ranking member of Senator Crapo stated in his remarks during the latest Senate Finance Committee hearing, anyone who has looked at the flow chart or diagram of the drug supply chain can attest that the only clear thing about it is how unclear and opaque it really is. We need an all-above approach to transparency that empowers consumers, plans, providers, and pharmacies to make informed, cost-effective, and clinically appropriate decisions, as well as to practice meaningful oversight. Our nation's Medicare program cannot be sustained if third-party entities are exploiting it for every possible profit opportunity. We must do more and do it quickly. PBMs, companies such as Express Scripts, United Healthcare, and CVS Caremark, say they are invaluable and pretend to be on the patient's side, but this is not true. In reality, PBMs are one of the largest contributors to rising prescription drug costs, closure of small business pharmacies, and subsequently the increasing prevalence of pharmacy deserts in our communities. CMS itself reported that Medicare-related fees, also known as DIR fees, assessed on pharmacies by PBMs rose more than 107,000% between 2010 and 2020. My pharmacy's DIR fees were $200,000 each year in 2020 and 2021. They were $300,000 last year. These fees were clawbacked months after a pharmacy fills a prescription and are unpredictable, inconsistent, and one of the leading drivers of pharmacy closures across the U.S. Pharmacies cannot sustain these fees, including mine. Our seniors depend on access to their pharmacies and the continued solvency of Medicare, something that cannot happen if profiteering by PBMs and the parent corporations continues to run unchecked. It is wonderful that Medicare can now negotiate drug prices. 60 medications in the next several years is great. Also, my patients will be able to benefit from the no-cost sharing on adult vaccines, such as those covered under Medicare Part D, such as the shingles vaccine. We are also excited that the monthly co-payment spend on insulin for Medicare beneficiaries is capped for $35 for those insulin products covered by Medicare D. Let's continue the progress and urge Congress to pass the Bipartisan Pharmacy Benefit Manager Transparency Act and ask President Biden to sign this important piece of legislation without delay. And let's join Congressman Gallego and other leaders who are calling to expand the insulin price cap to all diabetic Americans. Our patients and their access to affordable care depends on it. Thank you.
Thank you. And next, we'd like to invite our community member, Manny Hernandez.
Hello, I've been a diabetic for over 25 years. I want to thank everybody up here for fighting for me. I'm a life experience. I don't need any notes. About 20 years ago, when I found out I was diabetic, didn't know what to do. So I started getting on insulin, and then after about 5 years on insulin, they started putting me on the pen, which is a different kind, and just overnight, it went from a tier 4 to a tier 3 and jumped up $655 for me to get it. I stayed off for a year, which was the wrong thing to do. It affected my feet, my eyes, my kidneys. Someone told me to go to Mexico to get my insulin, so I started doing that, which made me better. I know for a fact that when you get off of it, because of cost, it can affect you. I want to thank Congressman here for fighting for me, and I hope he continues to fight, and for all the diabetics out there. Thank you.
Thank you. Thank you so much. And it's for such a rich country, the fact that our citizens have to travel to Mexico to get life-saving drugs is an embarrassment. It really shows that our values aren't aligned. And lastly, I'd like to introduce Mary Lynn Kosinek as the President and CEO of the Area Agency on Aging. Thank you, Mary.
Thank you, Congressman Gallego. I really appreciate being here. As President and CEO of the Area Agency on Aging, we serve about 122,000 individuals throughout Maricopa County, mostly those that are 60 and over, but also those 18 to 59 with disabilities and long-term care needs. We get about 65,000 calls a year from seniors concerned about not being able to afford food, not being able to afford housing, not being able to afford medical care. I'm very proud that Marco Mendoza is here from our Benefits Assistance Program. He and his staff and volunteers help over 16 to 18,000 individuals understand how to get the best cost in medical care, including prescription drugs. So, prior to the passage of the Inflation Reduction Act, as other people have said, people have had to choose between buying food, paying for housing, paying for utilities, and all of that. And so we are very grateful for the support of the congressman for passing the Inflation Reduction Act and reducing the cost of insulin. And before I turn it back to you, Congressman, I want to say thank you for all that you do for Arizona's older adults. Not only have you advocated for the insulin cap, but we know firsthand that you work very hard to help veterans and vulnerable senior population that is facing homelessness. So your efforts are very noble and recognized by all of us, and we really appreciate all you do.
Thank you, everybody. And to summarize, we've done a lot. We have really progressed very far away with the Inflation Reduction Act. But clearly there's more that can be done. There's too many portions of our population that are skipping insulin, that are rationing themselves, or that are traveling down to Mexico to pick up insulin. And so our job is not done. My job certainly is not done. We want to fully be able to push more reforms to make sure that we have the capability to negotiate not just a few drug prices starting in 2026, but more and sooner. And certainly when it comes to the ability to cap insulin for everybody, whether you're on Medicare or not, whether you're 6, 16, or 66, your insulin should be capped at $35 a month. It's the right thing to do. It is price gouging when at a scale that is inhumane, and our citizens don't deserve that. With that, I'll take any questions, and thank you so much. So thank you. Do you want to take a picture first, Jack? Yeah, let's take it. Don't want to force everyone to be standing up here the whole time.